Do braces really help with knee pain? Have you been struggling with knee pain for a while now and been told maybe by a doctor or your neighbor or your parents that you should try using a knee brace and you're just not sure if you really should? Or maybe you're just wondering if it would help prevent knee pain. We get a lot of questions here at Physical Therapy for everybody, particularly regarding bracing and if it should or should not be done when you have knee pain. So for this particular one, I actually went and studied the most recent research, the most up-to-date research on knee bracing. And it was super convenient because the American Physical Therapy Association just had a combined sections meeting, and of course all of it was online. So I got to read all the research and hear all the research, particularly on knees and bracing. So I am up to date and I am ready to give you a very clear and concise answer on whether or not you should use a knee brace for your pain, for your knee pain. Are you ready? I can tell you're on the edge of the seat. You ready to hear the super concise answer? All right, here it is. Maybe. I know, it's not the answer you wanted, right? I get it. I'm sorry. I wish I could give you a super clear black and white answer on if you should use a knee brace or not for your knee pain, but it's just not that simple. And let me explain to you why. I did actually study the most recent research on particularly knee braces. It was actually on all kinds of different treatments for knee pain, but part of it was on bracing in particular. And what they actually found in the research and the literature is that wearing a brace did not change people's knee pain. It also didn't change their biomechanics or how their knee was functioning in their day-to-day life, which is probably why it wasn't changing their knee pain. And so the research, actually the clinical guidelines that we are told to practice by say that you actually shouldn't use it because it actually doesn't help. However, I don't believe that anything is super black and white in this world, and so I have a little bit of a different opinion. I have many patients who have really benefited from wearing a knee brace, specifically when they have a lot of pain and they need to do just day-to-day activities, make dinner for their kids, walk upstairs, super simple things like that. I've also had patients who would wear a knee brace when they were doing higher level activities, such as running, jumping, playing soccer. And for those people, they didn't have pain with day-to-day activities, but they needed a little bit extra, more stability, more support while they were doing their higher level activities. And they were then able to do them pain-free. So how is it that it actually does functionally help people in certain situations, and yet the research doesn't support it, very clearly does not support it? Well, it's hard to do research. You have to try to find people who are equally matched for their diagnosis, their body type, and all of these different things in order to have one have the intervention or the treatment and one be the control group who didn't have it. Which means in physical therapy research, because it's really hard to find people who are matched in such a way, that the groups that they tend to have in the research they're actually pretty small. So sometimes you'll have a whole group of people in a research project that don't have any benefit from no help with a knee brace. I can tell you in my clinical practice, I've been practicing for 20 years, I have seen certain patients have benefit from a knee brace. So the struggle is it's really not black and white. And you really need to talk to your healthcare professional who really understands your body, who understands the research, but who also understands where you are on your journey to healing. So as I mentioned earlier, I have some patients who have so much knee pain they can't even stand to make dinner or walk up and down the stairs because it just hurts so much. But when they were able to do those activities and have less pain, and because they have less pain, they aren't changing how they're moving as much, so they're not causing as many secondary accidents or incidences because they're able to walk or stand more normally. Now, of course, our goal is not to have them wearing the knee brace forever so that they can make dinner or walk up and down stairs, right? That's why you do physical therapy, right? Because we want to get everything moving better and get those muscles stronger so that pain goes away. But sometimes that knee brace can be helpful for that period of time. I also had a patient who very, very recently who was wearing a knee brace regularly throughout the day, but as things started moving better and he started feeling better, he still needed to have it on while he was exercising, or else after he was exercising, he would get a lot of inflammation. So that knee brace, which again, in research, it says it doesn't actually change how anything's moving or the position it's in or anything like that. Well, for him it did, because when he wore it when he was doing those higher level exercises like running and jumping, he was able to do them without having swelling afterwards if he wore a knee brace. So all I can tell you is that this is what I've seen clinically, and this is what I've seen with my patients. And that's what we do here. I can give you my best advice. I will definitely look at the research, and I will definitely, if there is research to either back what I'm saying, or even if there's research that doesn't support it, I'll tell you either way, in all honesty. But I'll also offer you my clinical opinion of people like you that I've seen in the past, and if it's worked for them or not. Now, when it comes to something like a brace, there's not really any secondary side effects. I mean, if the brace starts hurting, you can just take it off, right? It's not like a medication or something that you're putting in your body that if you have some secondary side effects, you got to wait for it to work itself all the way out, right? So in general, my recommendation is try it. You really don't have that much to lose, and see if it's helpful. If it is helpful, then keep going with it anymore. Now, I will say the one exception to that. I don't like it when people wear a knee brace to do high-level activities that are causing damage. So some people will wear a knee brace because if they don't, they can't run or jump or hike or something like that. Now that's concerning to me, because if you can't do those activities without the knee brace, we could potentially be causing damage. And we definitely don't want to be doing something that's causing more damage to the knee, right? So I don't like to recommend a brace to do high-level activities that are actually causing damage to the joint. That's not good, because long-term, then we have damage in the joint. So even though the knee brace helped us be able to do that, we're still long-term not ending up in a good space, because we're ending up with that knee pain and that knee damage. But you know, sometimes you just need to wear a knee brace so you can stand up and make dinner, because that's life. And it can help. It can help be that kind of band-aid, be that piece that gets you through to the next phase while we're working on everything. Of course, getting things moving, getting the muscles stronger, all of those things that lead to that long-term healing. So as long as you're not doing anything while you're wearing the knee brace that's causing long-term damage, then go for it. If you're concerned of, am I doing anything that's causing long-term damage, and you want to talk more about that, I encourage you to give us a call. Our phone number is 425-658-4944. We're happy to have a body chat to learn more about you, your story, your knee, if bracing is the right option for you. We can give you some ideas and talk you through more specifically your situation, and see if you might be a good fit for what we offer here at Physical Therapy for Everybody. All right, if you have any more questions, feel free to drop them below. I'd be happy to answer them, and have a great day.